Welcome to Best Practice Live. Today we have a caller with a question. Vikesh from Trinidad has a herniated disc. We're going to go over the MRI, find out how this is affecting his life, and go through his options for its treatment. All today on Best Practice Live. All right, Vikash, how are you today? It's nice to see you.
I'm fine, and you?
I'm fine. Thank you very much. Where are you located?
I'm looking in Trinidad.
Trinidad Tobago, the Trinidad part?
Yeah,
Uh,
yeah.
and how old are you, sir?
I'm 22.
22. I've got your MRI. We'll go through it together. It looks like you've been dealing with a herniated disc for a while. Is that correct?
Yes, that's correct. 2 years.
How did it start? Did something happen or come on itself?
Um, I left a gas tank on my shoulder.
And how heavy was the gas tank?
It was approximately 100 pounds.
Okay, so this was a very heavy thing. You were holding it on your shoulder and then you felt a pop in your back?
Yeah.
Okay. Did mom or dad have any back problems or this is the first time in your family?
My mom has back problems.
Mom has back problems. And you're only 22, but did you yourself have any back problems prior to this?
Um, Not really.
Okay, well, that's good. That's very good. Now, the pain, when it started 2 years ago, it was in your back, and then did it go down your leg as well?
Yes, eventually it started going down my legs, both legs actually.
Both legs. How long did it take before it started shooting down your legs?
Probably about a year.
About a year. And during that year, the pain was like a knife in the back?
Uh, Pain was, yeah, something like that.
Okay. Okay, and what about now? Are you having a lot of pain right now?
Right now, it isn't as much as it does be, but there's still a lot of pain.
Okay. And is the pain mostly in the back or in the legs?
Just now. Just now. Say again. I didn't hear
Is
you.
is your pain mostly in your back or is it into your legs?
Still not hearing you.
Can you hear me now?
Yeah.
Okay. Is your pain, is it mostly in your back or into your legs?
It's into my back and down my legs.
Okay. Are you having any numbness or weakness in your legs?
Slight weakness on both legs.
Okay. Are you able to walk okay?
Yeah.
All right. And are you an active guy? Do you play soccer or sports of any kind?
No.
No. Okay. Um, are you having any numbness in your legs?
No.
Okay. And is everything working in your private parts, your bowel and your bladder control? Are you peeing okay?
Yeah.
Okay.
Fine.
Fine. Very good. And no trouble with sexual function. I don't know if you're active or not, but no trouble as far as you know.
No, everything's fine.
Excellent. I'm glad to hear that. Okay. So, from your point of view, this herniated disc, the main problem for you that it's causing is pain. Is that correct?
Yeah.
Okay. Very good. All right. I want to look at the MRI that you sent. Is that okay?
Yeah, that's fine.
Okay. All right. This is the picture of your MRI. Can you see my screen okay?
Yeah.
Okay. This is your back, on the surface of your back. And this goes up to your head and down to your bum. And this is your spine in here. These are the discs, these flat discs. And the
Hmm.
squares are the bones called the vertebrae. So you can see at every level we've got a square bone, and then a disc, and then a square bone.
Yeah.
And these guys have numbers. This guy's number 5, 4, 3, 2, 1. But between the 5 and the 4, instead of the disc ending flush with the back of the bone, like it should, like it does there, we see this dark area coming out into the spinal canal. And this is, in your case, the herniated disc. Herniated means it's supposed to stop there, but it came through, and so it's herniated out here.
Yeah.
Does that make sense?
Yeah.
This is the whole width of your spinal canal. So this is the front part of your spinal canal, and this is the back part. And all of your spinal nerve roots are in there. And you can see the herniated disc really takes up the whole width of the canal. So this would be what's often referred to as a giant herniated disc. One of the things that's interesting about a herniated disc is the inner part of the disc is actually has no blood supply. And so your body will respond to that by trying to dissolve it. Your body will treat that inner herniated disc as if it's foreign to you, and it will chew it up. And if it was a very small disc herniation, then your body would have a very small amount to chew up. But yours is not just large, it's giant. And your body just hasn't been in the 2 years. Normally, your body would chew all that up, and it just hasn't been able to do it. And as a result, we still have most of the spinal canal being filled with the disc material.
Yeah.
The options for treatment are generally 3. One option is do nothing, just wait until your body chews it up. But in your case, you've been waiting for 2 years and it hasn't done it.
Yeah.
A second option is to have epidural injection. Have you had any injections?
No.
Well, the epidural injection is for pain control. It doesn't in any way cause the disc to go away. It doesn't melt it. It doesn't do anything like that. But it does help with pain control. But it only helps with pain control for a few days. And given that you're now a couple years into this, that probably doesn't make sense. And then the third option is surgery, where they go in with a microscope and remove the part of the disc that is protruding out. Is that surgery an option for you in Trinidad?
Yes. I had a doctor recently that wanted to do it, but he said he can't do the discectomy. He can do an open discectomy because of the size of it.
Yeah, the microdiscectomy is the operation is done through a microscope, and the traditional discectomy, the open discectomy, is they make a bigger opening and they go in and take out more material. And I mean, that makes sense to me that he would want to do a traditional one. In the United States, that probably they would do a microdiscectomy no matter what, but it's certainly within what they call the standard of care, kind of what's normal for a surgeon. And the surgeon that you're talking to in Trinidad, it's a surgeon in Trinidad, I assume.
Yeah.
Is he an orthopedic surgeon or a neurosurgeon? What kind of surgeon is he?
He's a neurosurgeon.
A neurosurgeon, that's excellent.
Yeah.
Yeah, and it sounds like you trust him and you have confidence in him.
Yeah.
Okay. So what are you thinking? I mean, your only real option is to have at this point, the only option I could see for you would be to have the surgery. What are you thinking? Do you want to have it or you do not want to have it? What are your issues?
Well, I went and do therapy because there was some people saying that therapy can help and they can do therapy on it and whatever, but it didn't help. I did therapy and nothing.
Yeah. Therapy doesn't really do anything because therapy is for mobilizing the joints, but this problem is the herniated part of the disc. And no matter how much they move you or correct your station or how well intentioned they are, it's not going to alter the underlying issue, which is the herniation. So I would say, okay, you tried it. I wouldn't have thought it would work, and it didn't work. So it's really just not an option going forward. Are you fearful of having surgery?
Not really, just a bit.
Um, and what kind of work do you do?
Um, well, I do office work.
Okay. So how much work did you talk to the surgeon about how much time you would have to take off work to have the surgery?
He said 2 to 3 months
Yeah.
recovery time.
Yeah, and you're a otherwise healthy young guy. It could be even
Yeah.
less. Um, some of the risks of a surgery like this would be that you could get a deep-sided infection, that when he's removing the disc, he could cause damage to the nerve roots, and that could cause weakness or numbness that could, in rare circumstances, be permanent. One of the biggest risks is that he could remove all the herniated disc, but it could herniate again. And that's a big risk given the size of the herniation and the amount of time that it's been there. So I think you would have to consider these risks against what if you don't have surgery. And I would be very concerned for you long term if you don't get those nerve roots decompressed. It's not likely to get better on its own. It's very possible for you to suffer internal damage that you're not sensing, that you would not be able to recover from. And so if I were your brother or your father or your doctor, I would really recommend that you move forward with the surgery with the qualified neurosurgeon.
Yeah.
So what are you going to do?
Well, I'll think about it, and most likely I'll do the surgery because I wanted to do the surgery before, but my parents didn't want me to do the surgery.
Are they there?
They
Can
want,
I talk to them?
no, they're not here right now. They was
Okay.
here earlier.
Well, if they want to talk to me about the surgery, I'd be happy to talk to them. I understand their concerns. It sounds to me like you have a mother and a father who love you very much.
Yeah.
However, there's really not a lot of choice in this situation. And the best thing, in my impression, if you were my son, what I would tell them if they were here, and please feel free to play this for them. I understand you love your son. I understand you're worried about your son, but your son needs surgery in order to go on and lead a normal life. And the neurosurgeon that's available, a neurosurgeon is the most qualified doctor in the world for this kind of situation. So I really would strongly recommend that Vikash move forward and get this taken care of. All right, is there anything else?
No, not really.
Well, if you have any other questions, don't hesitate to contact me. It's been very nice talking to you today.
You too.
Bye now.
Bye.
Well, I really feel for Vikesh. He's a young guy facing a very significant problem with giant disc herniation, but it could be a lot worse. He's not having neurological problems. He has bowel and bladder control. All of the red flags we look for are actually absent. So that's certainly reassuring that if this neurosurgeon he found can remove the herniated part of the disc and that torn annulus heals up, he could go on and lead an entirely normal life. I'm really happy for him that he has the option of good treatment. He's already had good imaging, and we'll wait to see what happens. Hopefully we'll hear back from him further down the road. What I want you to notice is it's basically the same three options for herniated discs, no matter who you are or where you are. It's wait it out, epidural injection to temporarily control the pain, or microdiscectomy surgery to go in and remove the herniated part of the disc, not the whole disc, just the herniated part. For Best Practice Live, I'm Dr. Dan Lieberman. If you have a question you would like answered on Best Practice Live, there are 3 ways to ask. Leave a comment on any of our social channels, click the link to our website and complete the submission form, or call us at 602-256-2525. The more information you can give us, the better we can answer your question. So please contact us and we can walk you through uploading your imaging to a secure server. Please like and subscribe to our channel to stay up to date with information about your spine and joint health. Lastly, be sure to check out new episodes every weekday at 10 a.m. Pacific, 1 p.m. Eastern, where we answer all your questions.